Welcome to Module 6. In Module 5, we learned about antibiotics. And most of you were familiar with antibiotics because you've probably been prescribed one at some point in time for a simple bacterial infection such as a strep throat. Well, in this module, we will be studying medications that are prescribed for viral infections or fungal infections. Many times patients would go into a provider's office with a simple viral infection, such as a cold or an upper respiratory tract infection, but think an antibiotic may work, so they'll ask the provider for an antibiotic. The provider will tell them that antibiotics are for bacterial infections, that what they have is a simple virus. Go home and rest, have some fluids, etc. Well, can you think of situations in which rest and fluids may not be enough to help a viral infection? Take influenza, for instance, or the flu. Sometimes, especially in certain populations like the elderly or young patients, can cause a very severe illness, leading to a 10 or more day fever, high fever, cough, fatigue, and can lead to things such as pneumonia. So we will be studying antiviral medications such as this, called romantadine, that would be prescribed for a patient who would present to their provider's office within the first 48 hours of having the flu or influenza. Another viral infection you may have heard of is shingles or herpes zoster. This too could be a severe viral infection from herpes zoster that can cause severe pain and complications. So for this viral infection, we would give the patient acyclovir, perhaps. HIV, as you know, is a very serious viral infection. If you've recently seen the movie Bohemian Rhapsody, it's about the rock group Queen, and Freddie Mercury gets diagnosed with HIV and very soon after loses his battle with AIDS. Today, because of new HIV medications that we have, HIV is no longer the death sentence that it used to be. Well, in this module, we will be studying 5 classifications of HIV medications. So we want you to watch the HIV video, and you will see how these medications attack HIV. The other group of medications that we will be studying will be the antifungal medications. These medications may be familiar to you too. It is common for young men to get athlete's foot or young women to get yeast infections or candida. These infections are treated with antifungal medications, commonly with the classification that ends in azole or azole, such as clotrimazole or fluconazole. Very serious fungal infections, which may invade the lungs and other organs and cause severe complications, may be treated with amphotericin B. This medication may be referred to as amphoterrible because of some of the severe adverse effects that may be caused from this medication. Lastly, when you are studying these medications, we want you to continue to think like a nurse and think about what is the action of these medications? What are the adverse reactions? What are interactions with different medications or foods? What are the effects that you will see on lab tests? What contraindications or cautions? When don't you want to give these medications? Or when do you have to be very careful when you give these medications? How will you know if these medications are safe during pregnancy? What are some other nursing considerations and other patient teaching information that you must provide to your patients when being prescribed these medications? Also, be sure to utilize all of the resources of the module, including the other videos, the Prep U questions, the self-assessment, and of course, make sure to read your text. Have a great week.